Good morning. This is Dr. Hart with Nursing with Hart, PhD. These are some practice questions on delegation. It's very important that you know the delegation test questions, especially the 5 rights of delegation. And here they are. Okay, we have the 5 rights of delegation: right task, right circumstance, right person, right direction and communication, right supervision, and evaluation. So these are very important to know. You might learn these in your leadership class or a fundamentals class perhaps, but these are important. Look these up for your particular state. It's important because they do vary by state, and this will be your Nurse Practice Act in your state, and that will give you the information for each position, UAP, practical nurse, and registered nurse, and what their scopes of practice are for each professional staffing position in a hospital. These are very important, okay? So let's go on to some practice questions. A nurse on a medical surgical unit has received change of shift report and will care for 4 clients. Which of the following tasks should the nurse assign to an assistive personnel or AP? A. Updating the plan of care for a client who is post-operative. B. Reinforcing teaching with a client who is learning to walk using a quad cane. C. Reapplying a condom catheter for a client who has urinary incontinence. Or D. Applying a sterile dressing to a pressure injury. Okay, we'll give you a minute and then we'll come back to talk about this one. Okay, let's come back, and the correct answer on this one is letter C. Okay, letter C is reapplying a condom catheter for a client who has urinary incontinence. Reapplying a condom catheter is a non-invasive procedure that the AP can perform within their scope of practice. Let's look at the other answer choices. Letter A, updating the plan of care for a client who is post-operative. Okay, anything involving the nursing process. So you're thinking about assessment, nursing diagnosis, right? Planning. And I did a video on the nursing process, and I will link that down below. Planning, ADPI, planning, implementation, and evaluation. Those steps of the nursing process, those are strictly registered nurse responsibilities. Okay, so updating a plan of care, that's part of the nursing process. So that is strictly for registered nurse. And then, of course, in advanced practice, registered nurse also, because they're above the registered nurse. Then we have letter B, reinforcing teaching with a client who is learning to walk using a cane. So any kind of teaching is strictly registered nurse. Any teaching patient education cannot be conducted by the AP. This is strictly for the registered nurse. And then D, applying a sterile dressing, okay, to a pressure injury that requires special skills and clinical decision making, knowledge, skills, and judgment in order to perform a sterile procedure. And that's something you will learn in nursing school as a registered nurse. All right, next one. A nurse manager is assigning care of a client who is being admitted from the PACU following thoracic surgery. The nurse manager should assign the client to which of the following staff members? A, charge nurse, B, registered nurse, C, practical nurse, or D, assistive personnel. Okay, and I'll give you a minute to think about this one and we'll come back. Okay, let's come back to this one. Let's look at this question. So the correct answer is B, registered nurse. Let's see why. Because let's look at the stem of the question. What is it the question asking you? It's asking for the nurse manager assigning care of a client who's coming out of surgery, PACU, right? Post anesthesia care unit. After surgery, very important things that have to be done by the registered nurse. They're coming out of anesthesia, so there's a lot of safety issues. If you need to ambulate them to the bathroom, it takes a lot of skills and judgment to make sure there's no falls after surgery. They may be in pain. You have to do a lot of assessments after surgery. You may be assessing for bleeding. You may be assessing for safety. Can they get out of bed? What are the doctor's orders after surgery? Okay, so lots of things, skills, nursing, judgment for a patient after surgery. Okay, so that all requires a registered nurse. The other answers, the charge nurse, yes, is of course a registered nurse, but the charge nurse may be taking care of other administrative tasks. They're handling the schedule, the assignments, they're handling emergencies that come up. They may be, they're of course going to run to a code along with other nurses. They may not fit. They generally wouldn't be assigned to a patient coming out of surgery. See, practical nurse, definitely not. This is requiring assessment, a lot of assessment after surgery. So this would not be for a practical nurse, and definitely not for an assistive personnel, okay, for those same reasons, assessment, okay, and all the things included in the nursing process. All right, next one. A nurse is delegating the ambulation of a client who had knee arthroplasty 5 days ago to an AP. Which of the following information should the nurse share with the AP? Select all that apply. So these are good questions, practice questions on select all that apply. Select all that apply. Don't forget to look at each answer choice. Those are called the distractors. Look at each answer choice as a true false. Does it answer the question? Okay, A, the roommate ambulates independently. B, the client ambulates wearing slippers and anti-embolism stockings. C, the client uses a front-wheeled walker when ambulating. D, the client had pain 30 minutes ago. E, the client is allergic to codeine. Or F, the client ate 50% of breakfast this morning. And we'll give you a minute to think about it, and then we'll come back. Okay, let's come back to this one, and the correct answers are B, C, and D. Okay, so let's look at these. B, the client ambulance wearing slippers and anti-embolism stockings. That has to do with safety and ambulation. So an AP, so you're giving a report or you're delegating to the AP, which is an assistive personnel. So you have to look at, as a nurse delegating, you have to make sure that that person is skilled, has been trained on those things, and ambulation is one of the things that the AP has been skilled on. So they have to know if the client is wearing slippers and anti-embolism stockings, to be sure they keep them on, keep them safe. Okay, they're wearing those for a reason. So it's definitely B. Let's look at C. The client uses a front-wheeled walker when ambulating. Here is ambulation again. So the AP would make sure that the client continues to use that walker. If the doctor has ordered that walker, it's very important for the patient to continue using that. And the last one, correct answer is D. The client had pain 30 minutes ago. Why does the assistive personnel care if the client had pain 30 minutes ago? Well, think about it. If the client had pain 30 minutes ago, that means the nurse may have medicated the client for pain 30 minutes ago. And what happens with pain medications, depending on which one it is? The pain medication may cause dizziness, drowsiness, so they have to get up slowly from the bed or chair. Again, you're always thinking about the safety of the client. Okay, so those answers are B, C, and D. Let's look at the other ones. Letter A, the roommate ambulates independently. That doesn't concern the current client that you're assigning to the AP. The roommate, it doesn't apply here. Okay, and let's look at E, the client is allergic to codeine. The AP doesn't have to know client allergies. And F, the client ate 50% of breakfast this morning. The AP doesn't have to know about meals and how much the patient ate. All right, let's look at the next one. A charge nurse is assigning client care for 4 clients. Which of the following tasks should the nurse assign to a practical nurse, or PN? Okay, sometimes called an LPN, licensed practical nurse, same thing. A, creating a plan of care for a client who is recovering following a stroke. B, assessing a pressure injury on a client who is on bed rest. C, providing nasopharyngeal suctioning for a client who has pneumonia. Or D, teaching a client who has asthma to use a meter dose inhaler. Okay, we'll give you a minute to think about this one, and then we'll come back. Okay, let's come back to this one. Okay, and the correct answer is C, providing nasopharyngeal suctioning for a client who has pneumonia. So the practical nurse is permitted under their scope of practice to perform nasopharyngeal suctioning. Okay, part of their scope of practice for the PN or LPN. Let's look at the other answer choices. Letter A, creating a plan of care for a client who's recovering following a stroke. Here we go again with the nursing process. Think about this. Plan of care, or care plan, same thing. Care plan is created as part of the nursing process. Okay, assessment, nursing diagnosis. Okay, planning, implementation, and evaluation. ADPI. So the care plan is something strictly for the registered nurse. Okay. B, assessing a pressure injury on a client who is on bed rest. Keyword assessing. LPNs are not permitted to conduct assessments under their scope of practice. Again, part of the nursing process. And D, teaching a client who has asthma to use a meter dose inhaler. Anytime you see patient education or teaching, that is strictly under the scope of practice of the registered nurse. LPN or PN, practical nurse, is not skilled, does not have the skill, judgment, has not been educated on teaching a client how to use the meter dose inhaler. Okay, all right, let's go to the next one. A nurse is preparing for an in-service program about delegation. Which of the following are components of the 5 rights of delegation? Select all that apply. So in the first slide, I gave you the 5 rights of delegation. I will also put that in the description of the video so you can refer back to that. Okay, and so the answer choices are right place. A, right place. B, right supervision and evaluation. C, right direction and communication. D, right documentation. And E, right circumstance. Okay, so we'll give you a minute and then we'll come back. Okay, and the correct answers on this one are B, C, and E. Okay, 5 rights of delegation, B, C, and E. Right supervision, and B is right supervision and evaluation. C is right direction and communication, and E is right circumstance. So let's look at the other answer choices. A, right place. So that's more like right route with the medication. 5 rights of medication administration, okay? And then D, right documentation. Again, that's more like the 5 rights of medication administration, okay? So B, C, and E are the correct answers on that one, okay? And I'll put that down below in the description of this video so you can make sure you know the 5 rights of delegation. And that's all I have for now. So we'll see you on the next one. Take care. Look out for Nursing with Hart PhD. Please like, share, and subscribe if you wish. If this is helping you, comment on other material you may want to see. I cover mental health and fundamentals mostly. Okay, and we'll see you on the next one. Have a great day.